Hello. If you're new here, my name is Michelle. I'm a woman in her 30s. I'm a psychiatric nurse practitioner. I'm a single mother. I'm an immigrant. I moved to the US from Cameroon many years ago. It's been over 20 years. And I'm a traveler. I love to go places. On this channel, we're going to be discussing a little bit of all of those aspects. So, welcome. Thank you for being here. Please like, comment, or share, and my hope is to be able to build a community here. So thank you for being here. So today I would like to just kind of talk a little bit about kind of the people, some of the people that I meet at work, and because of the nature of my job, I get to meet people from all walks of life, and it's one of the best thing that could happen to me because I love people. I actually truly do. I love being able to talk to people, especially when it's one sided, when I find myself in the listening role instead. I don't need to necessarily give any advice. I'm just there to lend an ear and facilitate the conversation, give some prompts to kind of encourage a person to think about something a certain way, or a prompt to help go in another direction, maybe seek out more resources. It's just one of the best things that I can do. And the other day, I have this one patient. She's 17 and she's brilliant, and she just has me like, wow, got me thinking about how I was at that age. At 17, oh, no, I'm sorry, she's 19 now. This one, she's 19. And she's in college. She comes from a family that was not the best, but she is so driven, highly, like type A, incredibly organized, incredibly driven. She knows exactly where she's going. She knows the steps that she's going to take to get there. And she puts such a tremendous amount of pressure on herself. She does so much. She spends so much time on her own, so she's done a thorough study of herself, so she knows what works for her, what doesn't work for her. She takes the time to sit down every week and goes through her journal and identify needs what the various things that she needs to work on. She got in a romantic relationship recently, and before that, she did this whole self analysis. She sat down and thought about the reasons why they should get together, why they shouldn't, the things about him that she loved, the things that she thinks that they can work on, the like this whole incredibly detailed analysis of the situation. And I'm just like, you are 19 years old. How is it that you know all of this? Well, how were you taught to do that? And in her defense, she's been in therapy for many years, and she's actually gotten practice the tools that she's been learning in therapy. And it's so beautiful to witness. I mean, I can't credit therapy for all of it, but it's just her individual personality to begin with. It's such a go getter. And I'm looking forward to working with her for a long time to be able to witness as she grows, as she continues to thrive in whatever she decides to do. The whole we spent 30 minutes with her just literally going off and telling me about what's been going on in life, and I'll smile and I'll nod and I'll encourage and I'll be curious and I'll celebrate with her, and it's so great. And then on the other end of that, you have the people who they're in their 50s blaming their parents for their childhood, and I I am too of the train of thought that at a certain age you have to stop blaming your parents for the way your life turned out. Because if you're 50 years old still blaming your parents for not taking you to school or not hugging you far enough, that means that you have wasted um, a long life that you could have healed from that and taken interventions to get better and done things to differently to not turn out that way. And it's never too late. It's never too late. It's not a hopeless situation, but it's 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 not beneficial at all. And I think that people before they get to that point, even in their 30s, to at a point where they're like, man, my life is not going out the way that I wanted it to be because of the abuse that I underwent as a child. Like, no, get the resources you need. Go to therapy. Get the medications you need. There's whole bunch of books. There's a lot of podcasts. There's all sorts of resources out there to help people heal from what bothers them in order to be able to thrive in the future. There's EMDR therapy. And some families, I mean, I've said it before, some family is just incredibly messed up. I mean, we all know about it. We know some of the case studies that make the highlight reel, that make the news, and I do not discredit that. Some situations are just incredibly messed up, and but that is not the majority of the population, and more people than should be are blaming other people for their mistakes, and that needs to get better. We can't keep doing that, and especially here in the U.S. In Cameroon, I don't think it happens as much. Doesn't mean that the people shouldn't be blamed, but there should be an age limit as far as that. Then anything after, I feel like anything after 30 is it's on you. If there's any residual from that, then it's on you for sure. You need to do what you can to take care of that. And then every now and then I'll have a pregnant mother. Some of them are excited, some are not, and they're dealing with depression, and I have to do my part as far as educating them on the benefits versus the risk of being on medications while pregnant. And I love doing that. It's unfortunate that some of them are so depressed to the point that they have to come and see me. However, we have to weigh the benefits of the risk of being on medications while pregnant, because pregnancy is not supposed to be a miserable time for the mother. Over that, she's just biding her time until she can deliver her baby. And a lot of the time, if you're going through a significant amount of depression while pregnant, it puts the baby at risk too, as far as preeclampsia, because of elevated blood pressure, elevated heart rate, premature labor, and some other things. So the recommendation is to be able to take care of that if possible. There's no medications that's 100% safe when it comes to pregnancy and taking SSRI medications. However, there's some that have been found to be relatively safe. I've had patients on some like Zoloft or Lexapro for the whole pregnancy, and they did pretty well with that. And it decreases the risk of postpartum also, because with the delivery later, there's such a significant shift in hormones also, that coupled with very limited sleep, especially depending on how the baby is, and then if you're struggling with breastfeeding and everything else, just adjusting to that postpartum stage can be very difficult and sometimes traumatizing for some of the mothers. And if they were struggling with depression already throughout a pregnancy, it can be very, very challenging. So, look, a recommendation, if possible, if the mom can handle that with no medication, with using supplements like omega 3, vitamin D, and what else? Saffron, exercising, watching her diet, hopefully have a loving support system that will just kind of cocoon her in that time of need. All of that makes a tremendous difference. And for some people, it can be enough, but it's not always the case. Unfortunately, some people do have to go on medications, and um, there's a fear that they will be on medication for their whole life. It's not the case typically. There's some people like that, but it's not always the case. When I work with patients, I always tell them that the goal is to be able to, we shoot for like 6 months to a year once we find a good regimen. And then after that, if you're able to continue with those lifestyle modifications, that will increase your serotonin and your norepinephrine and your dopamine, then why do you need the medication? You shouldn't. And then we can talk about titrating that off. Now, and then also I get to learn about some of the coolest career. During the intake appointment, the first appointment, I always ask patients what they do for a living, and it's actually pretty cool too. Yeah, we live in a society that There's so much that's done in the background, the things we take for granted. We don't think about them, but they're the things that make our society turn, right? Like when we're stepping out of the house, we're using a GPS, and it's like, who makes those GPS? Who is drawing the roads that the GPS is finding? And who's delivering our food for us? Where's the food being made? We know about the satellites up in space. Who's navigating those satellites? We know about. I get to meet the dentist, the dermatologist, the surgeons, the insurance people, the lawyers. The lawyers want to be, and the Amazon workers, and all these people who do these incredible jobs that we don't really think about. And I love that too. There's a lot of careers out there because again, society has to function, and there's people in the background doing helping it function. I mean, with AI coming in, it's different, but that's a whole other story. Uh, and then I also get to witness people's transformation from the time when they come to get to see me. I've mentioned it in a previous video that by the time people come to see me, it's they actually almost in a state of desperation, which is unfortunate. Men, especially women, come a little bit earlier, but men they tend to be pretty desperate by the time they come to see me. But it's so beautiful to get them for where they are originally, to witness them reaching their potential and helping them through that. It definitely makes the bad days worth it for sure. And then of course, every now and then there's the bad review. The people telling you how awful you are because you don't agree with the treatment plan that maybe they were on already, and you want to have a conversation about how to safely transition to a different treatment plan, and they're not open to that. The people who are at the high risk of abusing medications, and you try to work with them as far as using all the medications that maybe don't have as high a potential for addiction, and they're like, nope, I want my Xanax, give me my Xanax, and not giving into that. Um, yeah, and then of course the ones also who come in with an incredible amount of anxiety, and they're or if they're under those bad regimens, this unsafe regimen is what I meant to say, and then to be able to transition them to something safer, and with couple with therapy, and watch them be able to have better management of the anxiety symptoms and start thriving, and the social anxiety going down, and they going to concerts and all of these things. It's very nice. Other people who again have been pregnant and they give birth and they raise their children. Sometimes they'll bring the kids summer visits, and I get to interact with the kids. It's pretty cool. Um, what else? And then the people who maybe at some point were suicidal, and then they got pulled out of that hole and they're doing much better. And then the people who were struggling with ADHD symptoms, we found a right regimen for them, and they're doing so much better. Schizophrenia is a rough one. It's rough because it affects so many aspects of people's lives, and the medications have so many negative side effects, which leads a lot of the time, often to patients deciding not to take the medicine anymore, which lead to negative outcomes in the long run. I schizophrenia, I struggle with that one. It's a very sad diagnosis. But there's a number of people who patients who are able to lead a fairly regular life. They're able to go to work and function, especially if they have a good support system. It makes a big difference. And bipolar disorder also, I have a lot of patients with bipolar disorder, witnessing them go through the ups and downs. Um, um, it can be a little bit challenging. And then it's the spectrum. There's some that it's a little bit of up and down, and then there's the ones that are down in the dumps, um, um, and going through episodes of mania, and some of them getting into car accidents because of the mania, or and then ending up in jail or in the hospitals. To be able to witness all of that, um, yeah, let's just say I have to do a lot of self-care in order to be able to carry the burden of all of this because it can be a bit much at times. So go home and hug my baby a little tighter and make sure that he's doing okay and play with him when I can and call my family. I exercise 5 days a week. I go on my trips. It recharges me. Uh, Whenever I can, I eat my favorite foods and yeah, spend some time doing my favorite things, record these videos, watch a lot of podcasts so that I can continue to educate myself. I read a lot of books. I don't spend as much time in nature as I used to, but I intend to fix that. And yeah, it's all great. I love my job. I love what I do, and it's definitely turning me into a better person. I had a conversation with the patient who I didn't handle the situation in a way that made her feel safe and secure. And it was very brave of her to bring it up. She doesn't like confrontation, so she had to bring that up to me. And we had to talk about it, and we came to a favorable outcome and clarify some things. And yeah, we're going to continue working together. So that was very nice too. So it kind of reinforces that I still have some things to work on as far as communication. I'm not perfect, far from it at all. And then also I have to be careful of my facial expressions, right? It's a telehealth, so the screen is right there. Gotta be careful. And then, yeah, to be able to verbalize things in a clear manner and with that being overly concise so that the patients can feel understood and safe and secure. That's important. And then, of course, reinforcing their feelings in a safe way. And then, you gotta walk that safe, narrow line of providing comfort and education at the same time without reinforcing negative beliefs. It's an art form that I'm still trying to get better at. But overall, it's a good job. I like it. It's a good career. And yeah, thanks for being here. I'm learning from my job a little bit, a lot every day. And if you ever find yourself struggling with mental health and you hesitate about seeking out help, I'll say I would encourage you to do so because who knows, it might be a better version of you waiting on the other side of all of that. So here's your encouragement to do that. Seek out help if you need to. Okay. Thanks for being here. We'll talk soon. Bye.